Episode number 261 of the Wholesome Fertility Podcast. My guest today is Dr. Bill Chun. Dr. Chun is a board-certified OB-GYN with over 30 plus years of experience and over 200,000 plus patient interactions. He is one of the most sought-after OB-GYNs in Greater Boston, and he is a very big advocate for women's rights. He's a Korean-American immigrant who also understands the struggles minorities face. Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist here to provide you with resources on how to create a wholesome approach to your fertility journey. Welcome to the podcast, Dr. Chun.
Thank you. You can call me Bill, like everyone else.
Okay, I'll call you Bill because you told me to, and I love that. And I love that you tell people to call you Bill. It feels so human.
Mm-hmm. I mean, probably the main reason is no one can pronounce my first name. So Bill is easier. I wish it was something else, but I'm stuck with Bill.
But Dr. Chun is pronounceable for sure, but it just feels a lot more friendly to call you by the first name.
Sure.
So I would love to get your background for the listeners to hear just your story and how you got into the work that you do.
Sure. So to go back from the time I was born, which I think is interesting. So I was born at home, which means I'm part of a free birth, unassisted. My mother was 16 when she had me, and my grandmother was there, but no medical provider. I lived in Korea for 12 years. I came here as a boy, and soon my parents divorced. I was raised by a single mother, very strong, my role model, my mentor. After high school, I studied with Annapolis or the United States Naval Academy. After about a year and a half, I realized military wasn't going to be my career of choice. So I left. Eventually, I found my way into a medical school in Columbus, Ohio. Then came to Boston at Boston City Hospital for OB-GYN training. And I've been in Boston for 30-some years. The bulk of my practice, or past 30-some years, I've been a solo practitioner. I mention that because the majority of physicians in this country are employed, which means we have to live by rules. And I feel like, you know what? I don't have rules. I'm going to do what I'm going to do. And
That's
I have
awesome.
enjoyed my solo practitioner capacity because I can provide the type of care that I think patients need. And that is based on communication, which means patients have my mobile number, which is available 24/7. And it really gave me that satisfaction of having relationships with my patients from the beginning to the end. I also have a large GYN practice, but overall, I like my practice because patients not only call me Bill, but they've been coming to me for decades, and I feel like I know them. I knew when they were in high school. Now I'm delivering their babies, which means I'm old, but it's really, I think I've been very lucky to go from my humble beginning to where I am. And I have much to thank for, especially this country, which I think is, in my opinion, is the best country in the world. Some may disagree, but many of them probably haven't lived in other parts of the world. So I appreciate what I have. That's my
Thank you for
story.
saying that. Yeah, thank you for saying. I mean, really, I'm feeling everything that you're saying so dearly. First of all, I feel like your work is heart-centered, and I love it. Patient-centered, heart-centered. And I'll tell you, when you have heart-centered, and I do Chinese medicine, we talk a lot about qi, which I know that even in Korea, you guys really understand. You understand the concept of that. It's very similar. It's kind of cousins. And I know even in Korea, there's acupuncture and they have it a little different. But the concept of qi really, and a lot of even martial arts, they talk about like the energy. So some things I always say, like with food or even with things in life, and you can apply with this with everything. Some things are more chi rich. They're more rich in energy. And when I feel when a practitioner works from the heart and functions from the heart, there's a little more of a richness where you're really truly connecting with your patients. And I think that that's an element that in most places is missing. And it's so wonderful to hear you talking about that.
I have surrounded myself with colleagues like you. I have a colleague who's an acupuncturist, herbalist, pelvic floor therapist, fitness person, and whatnot. They all like what they do. I mean, you have to work for a long time, and if you're lucky enough to find a career that you really enjoy, then really the work defines you, at least part of you. And I feel that, I have 5 kids, and aside from being a father, my work, it really means a lot. And it's every patient's encounter, which means I may have 1,000 positive reviews, but it's one negative review. I look at it and say, gee, what could I have done differently? And I'm sure you're the same way. And I think patients see that. So my practice, even though I practice in a very competitive area, I'm in Boston, it's a very competitive market because there are so many of us. And as a male OB-GYN, I've always been busy. And I think that's because from the very first time I had a private practice, back then I was giving out my pager number. Now it's mobile number. Patients had access to me. Being able to
Yeah.
speak with your provider really saves visits to urgent care, unnecessary over-the-counter medications, and above all, having peace of mind. And that's my job. So all I can say is I'm lucky, and I hope that all my 5 kids find the career that they like.
Yeah. I think for sure. I mean, when I changed my career, I used to do architecture.
Wow.
And I didn't feel very aligned with it. Yeah, I mean, it
Mm,
might be impressive and there's a lot that you can do with it for sure, but it just didn't feel aligned for me. And I changed my career eventually. But now it feels like kind of a hand in a glove. It feels so
yes.
natural. I think that
Yes.
that's really what it is. It's a combination of really feeling passionate about what you're doing and also just loving it and also it really being true to who you are. And I
Hmm.
love the fact that you literally came into this earth born out of your
I know.
house,
I know.
born out of your house. And it kind of goes into this whole topic of like pregnancy and labor being so natural.
I mean, I think about my mother in her early 30s, came to this country. She has, I don't think she graduated from junior high school. And I remember when I turned 13, I used English Korean dictionary to translate Ohio traffic law when I was 13. And
Oh
my
wow,
mother used that to take driver's license exam, and she
that's
missed one.
amazing.
She missed one. I'm like, gee, she did better than me, a few years
That's
later.
incredible. Yeah.
So women are powerful, strong, and how she took care 3 of us. I mean, this is what I do. My little brother is higher up in financial world, and my little sister works in Texas in a university. I think she showed us what it means to be a parent. Um,
Hmm.
Going back to pregnancy being all natural, I do believe that. But if you ask me, do I support free birth or unassisted birth? I'm like, look, I was
Yeah.
born at home. I was lucky. There was only
Yeah,
a few
yeah.
years after Korean War. But someone asked, and I'm going to actually interesting. I'm going to make a post about it today. Someone asked me what I thought. I said, no, because we have options. You could deliver in a labor and delivery room in a hospital if you have the right provider and maybe with a doula. You can
Hmm.
have unmedicated natural birth, but just in case something happens, you could do, help is available, and you could certainly do the same thing at home. But I don't believe free birth is unless you're in a really remote area in Australia or
Yeah. There's
middle of
nothing else you could do.
Southeast Asia, no Wi-Fi, okay, but not here.
Yeah, for sure. I mean, it's interesting because my husband's an emergency medicine doctor, and I'm
Hmm.
a complete hippie, And I wanted a birth in like water and
Ah,
dolphins. And he said, "Wait a second." He goes, "Listen, you get a doula, whatever, but
perfect.
in case there's an emergency, you have to think about
Yes.
everything." And this
Yeah.
is what the beauty is. I mean, there are definitely like it's nice to have the resources that we have today for sure. And so what are some of the things that you see as far as patient rights or things that you just witness in this world that you feel very passionate about?
I mean, I think right away our government doesn't support women, right? We, as the wealthiest nation in the world, who spends more money than anyone else, $14,000 per person. We don't have national health care. We don't have paid maternity leave. If you live in
Mm-hmm.
Bulgaria, you get 58 weeks and 90% of your pay. I mean, 58 weeks. Here, you don't have that. And then also, women earn less, 83 cents on a dollar. You
Mm-hmm.
start with that. But
Right.
who takes the burden? You do. You're the one who gets pregnant. So I find that in Boston, if you ask me, my hospital is considered premier. It's in a very affluent area. If you ask me who would I send my patients to for obstetrical care, I would say just a few because most of them are driven by money. It's money driven business. And and also the fact that half the country there's no like OB-GYN, right?
Mm-hmm.
Half the counties in this country do not have a single OB-GYN. So with the country being so big, about 10,000 births every day, a little under 4 million births a year, particularly women with financial disadvantage and women of color have limited options. And I don't see anything in the pipeline that's coming. There is no
Mm-hmm.
plan to increase number of OB-GYNs, which is already short. There's no significant increase or plan for increasing number of midwives. This is why only thing I think there's a hope is doulas, which is why I call this doc and doula. I think
Mm-hmm.
there's a hope because
Mm-hmm.
doula, to be a good doula, I mean, I think the best training program is Allo Academy out of Colorado, 200 hours of training. Plus,
Mm-hmm.
you have to go through an examination to be certified. If we have a standardized plan like that, with more doulas available, not only do we create a profession where a lot of women may have really a heartwarming profession that pays reasonable, but they're also available to help women. But right now, how can we have, the state of Arkansas, their maternal and neonatal mortality rate is so high, it's highest compared to any country in North and South America. This is how is this
Yeah.
possible? How is this? Are we in the same country? So
Yeah.
availability of resource is lacking.
Mm-hmm. It's
One out of
becoming like
three.
way more common. But just to kind of bring this to fertility, because a lot of people listening are trying to conceive.
Sure.
One of the things that I hear, this is something that I hear a lot from my patients, because many people obviously they're trying to conceive, but many are also having multiple miscarriages and repeated miscarriages. And some of the things that I just hear from my patients is that they feel like there is a disconnect with them. They feel almost like left to the side when they're going
Mm,
through a miscarriage.
yes,
I've even heard of people saying, I want to hold on to the tissue. I want to keep the tissue
of
so I can
course.
test it and know why this happened.
Hmm.
And then they'll come back and say, well, we lost the tissue. Better luck next time, kind of thing. Like
Yeah.
it's just so, if so hurtful. Like they're literally going through an open wound and they're kind of being tossed off to the side. So that's just one of the things that I hear pretty often. I mean, like repeatedly with my patients.
I mean, the reality is, even chemical pregnancy is a loss.
Yeah.
And whether it's first trimester or second trimester, loss is a loss.
Yeah.
And what do your patients do? They often internalize, they blame themselves. And I tell patients, other than the decision you made to get pregnant, the pregnancy is on autopilot. There's nothing you can do. But when a miscarriage happens, they internalize, and we don't have enough support system.
No,
And
definitely not.
we can barely get therapists in line for someone who delivered, but someone who miscarried, trying to find them therapist,
Right.
there's a shortage,
Yeah.
and we don't support loss well. With little under 4 million live births in this country, that means we may have how many millions of loss, right? Because we don't really know because People don't even know sometimes they're pregnant. But identified loss is real and it is
Yeah.
heartbreaking. And we don't have the infrastructure in place to help them understand, number one, it wasn't your fault. Number two, it may not recur. And
Hmm.
because we had actual sample, here's the reason why this happened. And this, often is because of chromosome abnormalities. Again, wasn't your fault. Doesn't mean
Hmm.
there's a problem with you or your partner, but I have had patients who become depressed for months
Hmm.
because of this. But like every aspect of women's healthcare, I don't understand why we cannot do this better. But it
Yeah.
all comes down to money. It's
Hmm.
money, money, money. And so what I joke and say, you know what? Our Congress is made up of only 27% by women. We need more women in the Congress. We
Hmm.
need more women in upper echelon of business and political offices because at least half of this country's population is women. And we don't have enough women making decisions.
Yeah. Yeah. You definitely have to have the yin and the yang, really, just
Yes.
because there is benefit to both. I mean, there's really benefit to both. And it's important to have those different perspectives for sure.
And I think your role is it can be challenging because many are coming to you to help them to get pregnant and stay pregnant. At the same time, working with women before they get pregnant is so crucial, right?
Yeah.
And because when someone says I want to get pregnant, the first question I ask is he the right person? Is your partner the right person?
Yeah.
In most
That's a
cases,
very good
that's
question.
number one. And are you in the
Yeah.
right place in time to get pregnant? And if I identify any risk factors, particularly medical issues, I say, you know what? Maybe we need to get you in a better place mentally, physically, and spiritually and do
Hmm.
this again. Um, but I don't think enough people prepare. You agree?
Yeah. Oh,
Too many
yeah.
people
Big
do
time.
not prepare.
Every so often when I get people coming in and saying, I don't, we just started or we're about to start. They don't even know if they're going to have an issue or not. I just want to prepare my body and I want to get the right supplements, the right diet. I want to talk to you, get some guidance, and I want to get acupuncture. And I'm like, oh my God, I wish everybody did what you're doing.
Right.
It's so refreshing to see. But I guess hindsight is 2020. And I guess a lot of people don't really know, and that's where education comes in because they really don't know that they should be preparing.
I mean, maybe it's related to our education. Maybe we should be teaching more anatomy and physiology in junior high and high school and college.
100%.
Make it mandatory, because people really don't have a basic understanding of human anatomy.
Yeah.
But if the outcome of a pregnancy is the most amazing life experience, don't you want that environment to be just right? I mean, it's that environment that has to be nurtured 24/7 for 9 months at
Yes.
the expense of that woman. But I just think, I mean, on one hand, I have good number of people who like yours, but I also others that come and, you know, I'm pregnant now. What do I do? I'm like, okay, well, we have to
Hmm.
catch up. Not enough preparation. You're right.
Yeah, definitely not. And another question I have for you is that when people are taking the birth control pill for a very long time, do you see? I've actually seen people come in and they get off and they get no period for sometimes up to 9 months.
Hmm.
So just wanted to see your take on that and what you've seen in your office.
I mean, I think what I tell patients is that once you stop either removing the IUD, the patch, the pill, or the ring, we should see what the first few months are like and see what your body is trying to do.
Hmm.
And it also allows them to, like you say, I try to prepare them to see if they can get on a right regimen for eating, exercise, and whatnot. And really keep
Hmm.
asking questions over and over. Is this the
Yeah.
right time? Is this the right time? Because once you get pregnant, your life is over. And how many people have come to you and said, wow, how come no one told me how hard it is to be a mother? Because it is hard. But initial few months, I think it's wait and see.
Hmm.
And for the most part. And as a general obstetrician, I do some routine workup. But if
Hmm.
I have to go beyond uh, Provera challenge or letrozole or Clomid, hysterosalpingogram, and beyond, I refer them to a local fertility center. Um, and Boston, being Boston, we have our selection of fertility centers. Some are small, some are big, and I try to
Hmm.
send them to where I think they are being provided support with kindness,
Yes,
because
100%.
fertility or infertility requires a lot of patience and
Yeah.
support. And some of the bigger ones, it's just, give me a credit card number. Here's your plan for next 3 months. These are medications you need, and it's just an assembly
It's like a
line.
factory.
Unfortunately, yes,
Yeah,
it's
yeah,
it's it's
100%.
shocking.
It's so impersonal. And I'll tell you, I mean, I feel like maybe I kind of feel like I remember somebody mentioning that there's even been a study like that people do better with the optimism of the doctor, that their care, when they feel heard and they feel that nurturing and that care, they actually have a better outcome. So,
And and I
yeah,
think
just
it
somebody
makes
listening.
sense. Yes, it
Yeah.
makes sense. I mean, every between our brain and your ovaries, the reality is we don't really understand. And everyone uses the same recipe and cookbook when it comes to fertility, but how are information delivered?
Oh, I love that. That
How
is so good.
that's that's the problem. And I find some of the local ones, they are using like medical assistant and whatnot to deliver, hey, your blood result was, you know, your FSH was too high, now you need, really? I mean, the patient waited all her life to try to do this. Now she's told she needs IVF. Could she be told maybe with a person where she could ask questions, who
Hmm.
doesn't seem to be in a hurry,
Yeah,
rather than just reading off a menu? And
100%.
I don't know, man. It's like I talk about Chinese restaurant a lot because I grew up and put myself through school through as a working in many different Chinese restaurants. Chinese food is rather simple. And when I look at restaurants, I look to see, is the restroom clean? Is the table and the menu clean? Are the servers whatever? Because the whole concept is, rather simple. And with healthcare, why can people be more polite,
Hmm.
professional, rather than, why do we have to talk about obstetric violence? What does that mean? Why are 40% of patients saying they're not happy with their care?
Hmm.
How can we be in these shoes? And I
Yes.
think it has a lot to do with the fact that the majority of physicians are employed and the majority of physicians are not happy doing what they're doing. And because it takes so long to be who we are, we don't have
Hmm.
alternatives. What else are we going to do? We have
Right.
student loans. It took us 12 years. What else am I going to do?
Yeah.
So
It's
it's a
the
total,
system, no doubt.
it's so bad. And I just feel so bad for my patients. And I give out my phone number to strangers and anyone who wants it, because often just a few minutes of conversation can ease their anxiety with
Yes.
just a couple of questions,
100%.
right?
I do the same thing, by the way. But I know I'm not quite as busy as your place. I'm sure you have so many people like texting you around the clock. But
It's
I find that just having that line of communication, it just puts people at ease, and they will not. Most of them, every once in a while, you'll have somebody who will take advantage, but very few will really take advantage of having that. They're very
you're
respectful.
you're absolutely right. My colleagues say you give out your phone number to your patients for 24/7. Yeah. How do you function? I function fine. I do all my stuff because the majority of people are respectful and they
Yeah,
love that they have
they're
access to
appreciative.
you. Yeah, and they
Yeah.
love that. And when they do use it, they go, oh, I'm so sorry for calling. It's Saturday. I said, no big deal. Saturday is no different than Monday in my eyes.
Yeah.
But it sounds like we practice very similarly, which
Yeah.
is why I'm on your program. Otherwise, I wouldn't be on your
100%.
program.
You were meant to be here.
That's right. And people
Yeah.
people really need your support. It's it just I just want to say women have to stop blaming themselves because it's not their fault. It's you go with what's given, and there's only so much you can do.
Yeah, 100%. But yeah, having that nurturing or that play, I have so many people saying like, "Oh my God, it's so nice to talk to somebody who understands," because I have nobody that understands. And sometimes they don't even feel like the husbands completely understand. Not that they're bad husbands, they're good husbands, but they just don't mentally understand the experience that they're going through or emotionally. And they said, to be able to talk to somebody, because a lot of times when people go through fertility challenges, they keep it private. They don't want to tell the world. They don't want to have to go
Yes,
through that, because if they do get pregnant and then they tell people and then there's a disappointment, they don't want to have to go through these constant emotional roller coasters, or at least to minimize it, what already is going on. But to have somebody who really understands and hears them is priceless. It
mm,
really immediately has an impact on their body. I can see
yes,
it.
very true, very true. And I think
No
that's
doubt.
why I have my patients are usually it's just referral through their friends and family. And I don't need local physicians to send me patients because I'm busy enough and I like taking care of somebody's girlfriends or sister-in-laws or family
Yeah.
members. It works really well.
Yeah. I mean, listen, I wouldn't imagine why anybody wouldn't go to you just based on what you're saying. And I'll tell you the truth, it's rare to have a doctor that is so also humble and warm and also empathetic in that way.
I think, I mean, when I say I got lucky, I got fortunate to be trained at Boston City Hospital in 90s when this is when things were just coming out, like cell phone, just becoming available. And my first job, I was so lucky to be matched with three midwives.
Mm.
Three midwives. I remember, they're telling, "Oh, Chun, you just finished the residency. Don't you dare tug on placenta. Like walk away. No episiotomy." People talk about this now, but this is the way I was taught.
Yeah.
And certified nurse midwives who really knew their stuff. And between three of them, they were able to really groom me.
Hmm.
And my first job, I remember the CEO of the hospital gave me a great financial package because I was so poor. I went to him because he was the highest bidder for my service, but he gave me midwives and he gave me an office with space, nurse, and a secretary, and zero patients. So I said, "Mr. Krigowski, I don't have any patients." "Oh, you find them." And he had me go out and find patients literally. So it really meant just figuring out how to make things work. And I found out quickly patients just want to be heard.
Yep.
That's it.
That's it.
So if you so my typical routine is I walk into a room and say, "Hey, how are you? My name is Bill." I sit down, cross my legs, and I lean back and say, "Hey, so what can I do for you today?" That's it.
Yeah.
And I never bring in a laptop. I just look at the white of your eyes and we talk. And
Yeah.
I say, "Oh, I think this is what we should do. If not, I don't think I can help you and let me find you someone else."
Yeah.
But that has worked for me. And it's a, it's an honor and privilege to be able to help others. And I get paid for doing that. So
Yeah.
really, I really have not much to complain about, you know.
Amazing. It really is
Yeah.
amazing. One other thing that I did actually want to touch on is, the MTHFR gene mutation. A lot of times people have this like almost policy that people have to have a miscarriage multiple times before anybody considers looking into that.
hmm
And
So
what's your experience been or what you've heard?
I think patients with those diagnoses usually I feel like they've already been worked up by others and then they
Hmm.
come to me. So I
Yeah.
really don't have much to do with that.
Yeah.
And I think that's true for most of us, generalists.
Okay. And I really appreciate and love the fact that you will refer people to fertility clinics once you get to a certain point where you realize, okay, because we all have our specialty.
And whether it's that or difficult robotic surgery, I like to contact my referral and say, hey, Jamie's coming over. This is her story. If you could just look out for her. Um,
Yeah.
and I want to make sure my patient doesn't get lost,
Yeah.
especially with busy fertility places. You get a number,
Yeah,
and it's
totally.
so hard to get an appointment. You get an appointment for telehealth like in 2 months, but I want to
Yeah.
make sure if that's 2 months, my referring doctor knows. And again, I have small number of colleagues who I know them and they know me, and we have each other's cell number. We just text and say, "Hey, patient's coming your way," and they'll send me, "Hey, this patient's coming your way because that person is an ectopic." Because I work as a GYN coverage for one of the fertility centers. But
Mhm.
having this relationship benefits me, but most importantly, my patients benefit because they're going to places where I know they get great care. And
Yeah.
I only send patients to where I would send my daughter. I have one daughter and four boys, and my precious princess, she can only see certain ones. And
Mhm.
if my colleagues are good enough for my daughter, then they are good enough for my patients.
Yeah.
And unfortunately, not all of them are good enough for my daughter and patients. It's
Yeah.
how, the reality is this, how, if you're a patient, what do? I mean, you're married to physician, so you have a little in, but how do you find the physician? The
Right, it's a
reality is
problem. You don't
it's a
know.
problem. You
Yeah.
have no idea.
Yeah.
So I and patients, especially if they're moving into a new city, new insurance or whatnot, they're in a bind. So I I get a request from different parts of the country and say, hey, can you find me someone you know? I say, okay, well, I probably don't know, but send me a zip code, and I find three names for
Mhm.
people to try.
Yeah.
And there's a way to do that using review sites and spending about 5 to 10 minutes. I've been able to come up with names, but I'm a physician. If you're a layperson, how do you do that?
Yes, that's
It's
right.
tough.
It's true. Yeah, for
Yeah.
sure. And then talk about the robotics. I hear a lot of amazing things about it. It's different than surgery that used to be performed before, and you
Yes.
understand that.
So when I went through training, we opened to everyone. It was abdominal his or vaginal his, and laparoscopic surgery where we make a little incision through the abdomen where we inflate the belly and use steel rods to perform surgery has been around for a while. And then 2009, Da Vinci robotic system became available for GYN surgery.
Mhm.
Now it's an amazing multi-million dollar system where I sit in a cockpit. I use two joysticks and 5-foot pedals to
Mhm.
perform a surgery. Essentially, let's say a hysterectomy, I detach the uterus and I deliver the uterus vaginally, and I
Mhm.
sew up that opening using robotic tools. And patients lose minimal amount of blood, and
Mhm.
recovery is also very different. But here's the problem: I'm 62 years old. I should not be the most experienced robotic surgeon because I'm 62,
Mhm.
right? The problem with robotic surgery is we don't have enough competent robotic surgeons. Can you
Oh,
believe that?
interesting. Because it's new. Because it's
It's
newer.
new, it's new, and it's like learning to fly a plane. So you
Right.
get your pilot's license for instrument flying during daytime and then nighttime, maybe from here to San Francisco, and then transcontinental eventually. But to be able to fly at under any weather,
Yeah.
it takes time. And what's the
Right.
problem? Especially OB-GYNs in their second half of 40s and up did not put in the time to be trained.
Right.
When I saw the robotic surgery, I knew this was going to be the game changer. So I put in the time. And now I'm very comfortable providing the service. Um,
Mhm.
if anyone's going to have a significant GYN surgery, I think this is the way to go.
Yeah.
But it's not available everywhere. And the key factor is surgeons. And it's
Mhm.
kind of like iPhone, iPhone 15 with all the best, the whistles and bells or whatever. most of us probably use only 5% of its functionality because we don't
Right.
really understand. It's
Yeah.
taking better pictures, better
Right.
battery life.
Oh,
But do
there's
we
a
really
whole
know the
like, yeah,
difference?
there's
Right?
courses for that.
Yeah,
Yeah.
exactly. With the robotic surgery, we don't have enough trained surgeons. And it is sad because technology is just getting better and better. And this
Hmm.
is the type of procedure where it doesn't make you an expert by doing 20. If you
Right.
say, I feel comfortable having done 20, I wouldn't send you my daughter. I
Right.
need to be at least
Totally.
couple hundred at least,
Yeah.
because it's few hundred before you feel comfortable.
Right.
Which similarly, let's talk about vaginal breech delivery. You know,
Hmm.
everyone says, "Oh, can you do vaginal breech?" Most of us are going to decline
Hmm.
because there aren't enough vaginal breech candidates per year for us to feel comfortable.
I
For
see.
busy for busy practice, if I do 200 deliveries a year with a 3 to 4% incidence of breach and only
Right.
half of them being potential, that's two a year. Two a year doesn't make me an expert. But I'm seeing on internet, oh, my midwife is comfortable. And I'm like, okay, because many of us aren't. So
Yeah.
trying to gain that experience, whether it's robotic surgery or vaginal breech delivery, it all takes time and numbers. And some of it is doable, some of it is not.
Yeah, no doubt. Well, this is awesome. I mean, I can keep talking to you and I just really am it's so refreshing to hear somebody who's so passionate about the work that they do and passionate about really empowering their patients. And for people who are interested in learning more about you, how can they find you?
I think if they go to Doc and Doula Instagram, it has all the links you need.
Awesome. And
Um,
I'll have the links also in the episode notes
yes,
if anybody wants it.
and for you, keep up the great work. I mean, to be able to do acupuncture, herbs, and all that, and working with fertility, if there's one thing, if I could do it over, you know what that would be? I would spend the time to be an expert in acupuncture and herbal medicine because,
Mm.
oh my God, if I could add that to my
Yeah, oh yeah,
menu,
that
oh
you'd be like a
man,
superhero.
I'd
You'd
be
have
right.
everything. That's amazing. That would be
It's
amazing.
I one last thing about herbal medicine. I had a patient who was scheduled for hysterectomy. She was on her way to LA for a conference. I could not stop her bleeding with all the prescriptions I've written. So I called a colleague, herbalist, and he said, you know what? I need her bleeding to stop for 2 weeks. He stopped the bleeding with herbs.
Yep, yep.
And then when she
I
came back,
believe
I
it's
did a
called Yunnan
hysterectomy.
Bio. Yeah, they use it for animals too. And I
It's
actually had somebody who reached out to me and because her dog was bleeding internally, and I met her on a Sunday and I
wow.
gave it to her. And she happened to be also a vet. She knew about it because of that. And
Yep.
ever since then, if I had any issues with my dog, I had her personal cell and she helped me out. So it was,
That's amazing. So
yeah.
you do something that I'll never be able to do. So anyways, thank you so much. And when my
Yeah.
studio
Thank you
is
so
ready
much
for
for coming.
podcast, I'm going to invite you.
Oh, that would be amazing.
Yes,
I would
of
love to
course.
be on there. Thank you so much, Bill.
Thank
Thank you
you.
for allowing me to call you Bill. And it was
Yes,
just such a pleasure meeting you.
thank you so much. Have a great day.
So that concludes today's episode. You can find all of the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to share and leave a review. Reviews mean everything to podcasters, and I really enjoy hearing from my listeners. You can also find me on my website at www.thewholesomelotus.com or email me at info@thewholesomelotus.com. I love hearing from my listeners. If you're interested and want updates as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com. I thank you so much for listening in and hope that you have a beautiful day.